The pills you take every morning to stay alive may be quietly opening the door to one of medicine's deadliest emergencies. What if your trusted prescription isn't protecting you at all, but slowly setting the stage for sepsis without warning? Welcome to Wellness Unfolds, where we uncover hidden health truths. Today, we explore a silent threat lurking in your medicine cabinet. Millions of people rely on daily medications to manage chronic conditions, believing these pills offer safety, stability, and long-term health protection. However, for those over 65, certain common prescriptions might unintentionally pave the way for a deadly condition known as sepsis. Sepsis is not just an infection. It is a life-threatening emergency where the body's immune response turns against its own tissues. Recent medical statistics reveal alarming mortality rates associated with sepsis, particularly among vulnerable populations with weakened or compromised immune defense systems. When the body detects an infection, it releases chemicals to fight it, but sometimes this process triggers widespread inflammation and damage. This uncontrolled reaction can lead to organ failure, septic shock, and death if not treated immediately with aggressive medical intervention. We have identified 5 specific categories of medication that may increase your susceptibility to this dangerous cascade of biological events. Understanding these risks is crucial for prevention, as awareness allows you to make informed decisions about your daily healthcare regimen. Let us begin with the first group: proton pump inhibitors, commonly known as PPIs, used extensively to treat acid reflux. Millions of people take drugs like omeprazole daily to suppress stomach acid and relieve the discomfort of chronic heartburn symptoms. While effective for comfort, stomach acid is actually your body's first line of defense against harmful bacteria ingested with food. By neutralizing this acid, we inadvertently allow pathogens like Clostridium difficile to survive and colonize the lower digestive tract easily. This colonization can lead to severe intestinal infections, which significantly raises the risk of bacteria entering the bloodstream, causing sepsis. Furthermore, reduced acidity can lead to bacterial overgrowth that may be aspirated into the lungs, causing pneumonia and subsequent sepsis. It is vital to discuss the duration of PPI usage with your doctor, as long-term use compounds these serious risks. Moving to the second group, we have non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen and naproxen, found in many homes. These common painkillers are effective for reducing inflammation and aches, but they carry hidden dangers for your kidneys and immune response. NSAIDs can reduce blood flow to the kidneys, potentially causing acute kidney injury, which impairs the body's ability to filter toxins. Crucially, these drugs reduce fever and pain, which are the primary warning signals your body uses to alert you to infection. By masking a fever, NSAIDs can delay the diagnosis of a serious infection, allowing sepsis to advance unchecked before treatment begins. Delayed medical intervention is a leading cause of sepsis complications, as early detection is the key to surviving this condition. For elderly patients or those with existing kidney issues, the regular use of NSAIDs poses a significant and often overlooked threat. The third and perhaps most critical group is corticosteroids, such as prednisone, often prescribed for asthma, arthritis, and autoimmune diseases. These powerful drugs work by suppressing the immune system to lower inflammation, but this mechanism is a dangerous double-edged sword. By dampening the immune response, corticosteroids leave the body incredibly vulnerable to bacterial, viral, and fungal invaders that cause sepsis. Long-term use affects almost every aspect of immunity, making it difficult for your body to mount any defense against pathogens. Infections that would normally be minor can escalate rapidly into life-threatening sepsis because the body's alarm systems are effectively disabled. Patients on these medications require strict monitoring, as even a slight fever or minor malaise warrants immediate medical attention. Our fourth category involves the misuse of broad-spectrum antibiotics, which might seem contradictory since antibiotics are used to treat infections. However, frequent or unnecessary use of these strong drugs indiscriminately kills both the harmful bacteria and the beneficial gut flora. This destruction creates a vacuum where dangerous, antibiotic-resistant superbugs can thrive without competition from your body's natural good bacteria. If these resistant strains enter the bloodstream, treating the resulting sepsis becomes extremely difficult, as standard medications will no longer work. Preserving your gut microbiome is essential, so antibiotics should only be taken when absolutely necessary and prescribed by a professional. Finally, We examine SGLT2 inhibitors, a newer class of drugs prescribed for managing type 2 diabetes and certain heart conditions. These drugs work by preventing the kidneys from reabsorbing sugar, causing excess glucose to be eliminated through the patient's urine. While beneficial for blood sugar control, sugar-rich urine creates a perfect culture medium for bacteria to grow in the urinary tract. This significantly increases the risk of severe urinary tract infections, which can ascend to the kidneys and cause urosepsis rapidly. Patients taking these medications must be vigilant about hygiene and hydration to minimize the risk of bacterial growth and infection. These 5 medication groups are vital for many, yet they carry risks that can silently predispose the body to sepsis. The goal is not to stop necessary treatment, but to understand the balance between therapeutic benefits and potential immune system compromise. Prevention starts with hygiene, awareness of your body's signals, and open communication with your healthcare provider about your prescriptions. Always ask if the lowest effective dose is possible or if safer alternatives exist for your specific medical condition. Strengthening your natural immunity through lifestyle changes is the best companion to any medical treatment plan you may be following. By staying informed and vigilant, you can protect yourself and your loved ones from the silent and deadly threat of sepsis. Knowledge is your best defense, turning the tide against infection before it has a chance to overwhelm your body's systems. Memorize the early signs of sepsis: fever, rapid heart rate, confusion, and shortness of breath, and act immediately if they appear. Time is tissue. Every minute counts when treating sepsis, and early recognition can mean the difference between life and death. Let's revisit the mechanism of proton pump inhibitors to understand why the stomach's acidic environment is so critical for survival. Natural stomach acid has a pH of 1 to 2, which is strong enough to sterilize almost everything you swallow. When you take PPIs, this pH rises significantly, creating a hospitable environment for pathogens that would otherwise be destroyed instantly. Studies have shown that chronic PPI users have a significantly higher incidence of severe gut infections compared to non-users. The danger extends beyond the gut, as bacteria can migrate upwards and be inhaled into the lungs during sleep. This mechanism is a primary driver for community-acquired pneumonia, a condition that frequently escalates into full-blown sepsis in the elderly. Consider lifestyle modifications, like smaller meals and avoiding trigger foods to manage reflux without relying solely on heavy medication. Returning to NSAIDs, we must understand that they work by blocking prostaglandins, chemicals that protect the lining of your stomach. This blockage can lead to ulcers and internal bleeding, providing yet another entry point for bacteria to invade the bloodstream. For localized pain, topical creams can often provide relief with significantly less systemic risk than oral NSAID medications. Combining NSAIDs with blood pressure medications creates a dangerous cocktail that places immense strain on kidney function and stability. With corticosteroids, the suppression of adrenal function means your body cannot produce its own stress hormones during an infection. This adrenal insufficiency can lead to a catastrophic drop in blood pressure if an infection takes hold, accelerating septic shock. The risk is dose-dependent. Higher doses and longer duration equal a more profound suppression of your vital immune defenses. Never stop these drugs abruptly. A careful tapering schedule managed by your doctor is essential to restore your immune function safely. Antibiotic overuse is the primary trigger for C. diff infections, a severe diarrheal condition that kills thousands of seniors annually. Once C. diff establishes itself, it produces toxins that damage the intestinal lining, allowing bacteria to leak directly into the blood. Taking high-quality probiotics during and after antibiotic treatment may help mitigate the damage to your protective gut microbiome. Doctors use antibiograms to select targeted antibiotics, avoiding broad-spectrum options that cause collateral damage to your healthy bacteria. For those on SGLT2 inhibitors, maintaining impeccable personal hygiene is the single most effective strategy to prevent urinary tract infections. Staying well hydrated ensures frequent urination, which mechanically flushes bacteria out of the urinary tract before they can multiply. Diabetic patients must also be wary of skin infections, as high blood sugar impairs wound healing and invites bacterial invasion. Your immune system is a complex, delicate network that requires balance to function effectively against the constant threat of pathogens. Every medication introduces a variable into this balance, and understanding that trade-off is the mark of an empowered patient. Don't hesitate to research your medications and ask your pharmacist specifically about infection risks and signs to watch for. Pharmacists are an underutilized resource who can provide detailed insights into drug interactions and side effects that doctors might miss. Vaccinations for flu and pneumonia are critical for high-risk groups, preventing the initial viral infections that often lead to sepsis. Viral infections damage the respiratory lining, creating a highway for bacteria to invade deep into the lungs and bloodstream. Simple acts like thorough hand washing remain the most effective way to stop the transmission of dangerous bacteria in daily life. Any cut or scrape should be cleaned and covered immediately, as skin breaches are common entry points for staph bacteria. Watch for redness, warmth, swelling, or pus at any wound site, which indicates that an infection is taking hold. Telehealth services allow you to consult a professional quickly if you suspect an infection without exposure to hospital germs. Early detection turns a potential tragedy into a manageable condition, highlighting the importance of speed and awareness in sepsis care. We must be especially protective of those with cancer, diabetes, or organ transplants, as their margin for error is razor thin. Chemotherapy drugs are potent immune suppressors, making the risk of neutropenic sepsis a constant and terrifying reality for cancer patients. Family members play a crucial role by practicing hygiene and wearing masks to create a protective cocoon around vulnerable relatives. The global pipeline for new antibiotics is running dry, making the preservation of our current effective drugs a global priority. Antibiotic resistance is also driven by agriculture, so choosing antibiotic-free meat and produce can contribute to the global solution. A diet rich in fiber and plant-based foods supports a diverse microbiome, which is your internal army against pathogen invasion. Never underestimate the power of sleep. It is during deep rest that your immune system repairs and regenerates itself. Chronic stress elevates natural cortisol levels, mimicking the effects of steroid medication and weakening your defenses over time. Stress reduction techniques like meditation or gentle yoga can lower cortisol levels, indirectly boosting your resilience against bacterial infections. To recap, be vigilant with PPIs, NSAIDs, corticosteroids, antibiotics, and SGLT2 inhibitors, as they all influence your infection risk. We must emphasize again, do not stop taking prescribed medications on your own, as abrupt withdrawal can be dangerous. Instead, use this information to start a conversation. Ask about monitoring, side effects, and the duration of your treatment. Regular blood work and urine tests can detect early signs of trouble before they escalate into a septic emergency. Monitoring your vitals at home gives you a baseline, making it easier to spot the abnormalities that signal sepsis. Hydration supports kidney function and maintains blood volume, both of which are critical when the body fights an infection. Sepsis survivors often face a long road to recovery, requiring physical therapy and emotional support from their community. Post-sepsis syndrome can leave survivors with lasting fatigue and cognitive challenges, underscoring why prevention is the ultimate goal. Share this knowledge with your aging parents and loved ones, as they are often the most vulnerable to these risks. Build a strong relationship with a primary care physician who knows your full medical history and medication profile. Modern electronic health records often alert doctors to drug interactions, but your personal vigilance is the final safety net. Avoid self-prescribing over-the-counter medications for long periods without professional advice, as they are real drugs with real risks. Even herbal supplements can interact with prescription drugs or affect liver and kidney function, so disclose everything you take. Your liver processes most medications, and overloading it can impair its ability to clear bacteria and toxins from your blood. Regular liver and kidney function tests are non-negotiable for anyone on long-term therapy with the medications we discussed. Nursing homes and care facilities must be particularly vigilant, as residents often take multiple medications that increase sepsis risk. Poor oral hygiene is another often missed source of infection, allowing bacteria to enter the bloodstream through inflamed gums. Regular dental checkups are essential, as gum disease creates a direct portal for oral bacteria to reach your heart. Moderate exercise improves circulation, ensuring that immune cells can travel efficiently to every corner of your body. Adequate levels of vitamin D and C are crucial for immune function, so ask your doctor about checking your levels. Keeping your living environment clean and well ventilated reduces the bacterial load your immune system has to fight daily. Pets bring joy, but can carry bacteria. Immunocompromised individuals should be careful with scratches and bites from animals. Practice food safety strictly. Undercooked meat or cross-contamination in the kitchen can introduce dangerous pathogens like salmonella. When traveling, be extra cautious with food and water, and carry a summary of your medical history and medications. Maintaining a positive mental outlook has been shown to improve physical resilience and recovery outcomes in medical studies. The medications we discussed, PPIs, NSAIDs, steroids, antibiotics, and SGLT2 inhibitors, are tools that require respect and careful handling. Think of your awareness as a shield, protecting you from the unintended consequences of the treatments meant to heal you. If you are taking any of these medications, we encourage you to review your care plan with your doctor soon. Share your experiences in the comments below. Your story might help someone else recognize a risk they had missed. At Wellness Unfolds, we are committed to bringing you accurate, life-saving health information based on the latest science. Science is constantly evolving, and we stay on the cutting edge to ensure you have the best advice available. The human body is a miraculous, resilient machine, but it needs your conscious support to navigate the challenges of modern medicine. Protecting our health is not just about us. It is about being there for the future generations who need us. Do not wait for a crisis to occur. Proactive prevention is always more effective and less painful than reactive treatment. Keep a health journal to track how you feel after taking medications, noting any changes in digestion, temperature, or energy. Your observations are valuable data points that help your doctor make better decisions about your long-term health strategy. Taking medications at the correct times and with the correct food or water instructions maximizes safety and minimizes risks. Alcohol can amplify the negative effects of many drugs, stressing the liver and further suppressing the immune system. Smoking damages the lungs' natural cleaning mechanisms, making the combination of smoking and PPIs particularly dangerous for pneumonia risk. Quitting smoking is the single most impactful step you can take to restore your respiratory immune defenses immediately. Use technology to your advantage. Medication reminder apps can help you manage complex schedules and avoid accidental double dosing. Always read the patient information leaflet that comes with your medicine. The warning section is there for your protection. Knowing your own medical details, including allergies and past reactions, speeds up correct treatment in an emergency situation. Regularly clean out your medicine cabinet, disposing of expired drugs that may have become ineffective or chemically unstable. Nature offers healing too. Fresh air and sunlight are fundamental to maintaining a robust and responsive immune system. Strive for a balanced life where medical intervention is supported by healthy habits, creating a synergistic effect for wellness. Your heart, kidneys, and liver work tirelessly for you. Give them the support they need by being medication smart. Sepsis is a formidable enemy, but with knowledge and vigilance, it is an enemy that can be defeated. If you found this video helpful, please like and share it to spread this vital life-saving information further. We are here to guide you through the complexities of healthcare, making medical science accessible and actionable for everyone. Check out our other videos on immune-boosting foods and natural ways to support your body's healing processes. Thank you for trusting us with your time and attention today. Your health is our greatest inspiration and priority. We hope you feel more empowered and less anxious about managing your medications after watching this detailed guide. Remember that your health is your most valuable asset, and investing in knowledge is the best investment you can make. Each day is a new opportunity to make better choices for your body, leading to a longer, happier life. Stay curious, stay cautious, and stay healthy as you navigate your personal journey toward optimal wellness and longevity. Please remember this video is for educational purposes only and does not replace professional medical advice, diagnosis, or treatment. Let us know in the comments what health topics you would like us to cover in our future deep dive videos. We love hearing from our community and learning together, creating a safer world for patients and families everywhere. Thank you for watching Wellness Unfolds. Please subscribe for more vital health insights. Stay informed and protect your well-being every day.